Can you hear me? Can you hear me? Who wants to continue free parking? Can I hear you? I'm not quite sure. Can I hear it again? Good afternoon, everyone. I'd like to introduce myself. My name is Steve Califer. In my other life, Flemington Car and Truck Country is so proud to provide the parking for our valued patients, our staff, to make the load a little bit lighter for all of us. We're proud to do it. One thing before we get started, anyone who after we're done this afternoon, early evening, would like to go to TD Bank Ballpark to be our guests for a game at the Somerset Patriots, just show your RWJ badge at the ticket window. You are our guests this evening. And we have fireworks tonight. As well as fireworks right here. I can't tell you how proud I am to be chairman of the Somerset Healthcare Foundation, a member of the Robert Wood Johnson University Hospital Board, and the Somerset Advisory Board. I will tell you, from being in those rooms, knowing of the care and concern for our hospital, our community hospital, the commitment, the investment that is being made in our future, I can't thank RWJ enough. Thank you very much. I'm just going to be another 2 minutes, but I do, on behalf of our former chairman, Paul Stalin, who is in Brussels and couldn't be here this afternoon, really wanted me to extend his congratulations to everybody and thank everybody for making this day happen. You know, what's really interesting, I was just in Trenton on some legislature business, and as the hospital world is changing, I can't tell you the security and the comfort in having the best partner there is, RWJ. You know, many of you might know me as a patient here, because God knows I've been here enough. I have received the finest care in this hospital as a patient many times, but 2 times in particular. When I was diagnosed in 1991 with non-Hodgkin's lymphoma, I could have gone anywhere. The pathology came from all across the country. Everybody told me where to go. I came here, and 23 years later, I'm here. So thank you. I was here long enough to be treated again in a very severe circumstance and situation. I was here when I had a carotid artery. It was diagnosed here, the surgery was done here, and I'm still here. I don't want to tell many more of the Steve Califer medical stories, but I'm very good for business here. And when I fell in the dugout at Yankee Stadium and tore my quadricep in half, right? They wanted to take me to Lenox Hill Hospital. I said, no, I'm going to Somerset, and I'm still standing. Today is a day of celebration. I guess the point and the passion that I have for this hospital and for RWJ and all of the resources they're going to bring to us is something that I almost can't fathom, but I do appreciate. And let me just say this. I attended my first board meeting in New Brunswick yesterday. And inside the boardroom, the concern, the care, the quality, the associates. That is what everybody's talking about every minute of the day. Without any further ado, let me introduce my good friend and Vice Chairman of the Robert Wood Johnson University Hospital Board of Directors, Jack Morris.
Steve, you're a hard act to follow, and I have nothing to give away today, so I'm very proud to be standing here today as Vice Chair of the Robert Wood Johnson Hospital, and on behalf of my fellow board members who have asked me to speak and say a couple of words, I'm delighted to do so. I'm also a resident of Somerset County, and I'm proud to be here. Hopefully I don't need all the services that Steve got, but if I do, I know where to go. It's a real pleasure to be standing here. I was instrumental in a lot of the negotiations, and it was near and dear to my heart to see that Robert Wood Johnson be the one to be your partner. And I can proudly stand here and tell you that we will perform not only for each and every person that we treat, but for the members of our team and our staff, which is very important to me and to my team at Robert Wood Johnson, now one as Robert Wood Johnson, here today. This is a very proud day for our institution to become one. Our partnership will provide and deliver the best health care in New Jersey. We and our partners at Robert Wood, Rutgers, Robert Wood Johnson Medical School, Rutgers Cancer Institute of New Jersey, Robert Wood Johnson Hamilton, Robert Wood Johnson Rawway, Children's Specialized, and now Robert Wood Johnson University Hospital Somerset, all part of our system. And I'm very proud to say that we will be one big family. I believe that together we are posed for the future of medicine and to deliver great health care for the residents of this community and throughout the state of New Jersey. That's important to me and to my board and to all the members of my team. And with no further ado, I would like to introduce our leader, our president and CEO, and my friend, Mr. Stephen Jones.
Jack, thank you very much, and thank all of you way in the back for being here today. I am thrilled that you are now part of Robert Wood Johnson University Hospital, the flagship for the Robert Wood Johnson Health System, and that's New Jersey's premier health system. I'm excited that this day arrived where we can bring to Central New Jersey expanded access to the finest in academic medicine. Before I began my career at Robert Wood Johnson University Hospital 32 years ago, I was an administrator right here at the medical center before I went to Robert Wood Johnson. I'm thrilled that my journey has taken me full circle, and we are now one. Our hospitals share a long and proud history of firsts, of achieving firsts, and of national recognition, both of our hospitals. I look forward to working side by side with you, our Robert Wood Johnson family, to build on that proud history and to achieve even greater success in the years ahead. We all know that outside healthcare environment is undergoing radical change. Healthcare reform and competition have caused us all to rethink where and how we provide care to our residents, our neighbors, our friends. Certainly the work we're doing right here to expand ambulatory care and outpatient care while strengthening the inpatient services shows that we are investing in the future health of our community. The merger between these two great hospitals and increasing our partnerships with the medical staff and our community is part of that ongoing growth. As Mr. Califer said in his remarks, when we entered discussion with Somerset's leadership, it ushered in a healthy, open dialogue about what the best outcome should be for Central New Jersey and for the employees of both hospitals. That's what it should be about when making a decision like that. The people we serve and the people who serve them. Now that the merger is complete, I'm very confident that we've made two great institutions even better. Maybe you've heard that theme before. Okay, I guess you have. Both hospitals have clinical strengths. Both hospitals have best practices. And we're proud to offer Central New Jersey residents access to exceptional women and children's services, cancer care, cardiac services, emergency services, neurology services, stroke services, orthopedics, and pediatric rehabilitation care, in addition to comprehensive health and wellness services. We look forward to expanding access through our partnership with Rutgers, Robert Wood Johnson Medical School, and Rutgers Cancer Institute of New Jersey. Once again, I welcome all of you to the Robert Wood Johnson family. I wish you success on your personal journey as part of the Robert Wood Johnson team. Now it's my pleasure to introduce Dr. William Sugarman, the president of the medical staff. We've very much enjoyed working with Dr. Sugarman on our transition. Bill, please come up. Thank you very much.
Thank you, Steve. Good afternoon, everyone. I didn't know when I became the president of the medical and dental staff that I'd have to go through so many different experiences, and certainly not one of being in the middle of a gigantic merger like this. But, you know, by going through this, I've seen firsthand the work that has gone into the merger, and I know that none of this could have been possible without all of the teamwork and collaboration that all of you have shown and that has always been the hallmark of Somerset Medical Center. As a member of the Robert Wood Johnson Somerset Advisory Board, I and several of my physician colleagues, who are also board members, have been deeply engaged throughout the entire decision-making process in selecting Robert Wood Johnson University Hospital. Along every step of the way, we have engaged our physician colleagues and listened to their concerns, and as well as shared our expectations with them. As many of you know, we have a large number of physicians who are on staff at both institutions. It is comforting to know that we all share the same vision of great quality care and patient safety. During this merger transition, many of our community physicians, myself included, have gotten a chance to learn more about Robert Wood Johnson University Hospital, and we are excited at the prospect of exploring a new level of combined academic and community medicine in multiple specialties here at the Robert Wood Johnson Somerset campus. I know I speak for all of the physicians when I say that it is all of you who make this a warm, caring, and friendly place to practice medicine every day. In a time of change, great opportunity exists. We all have the backing and the dedication and the support of the Robert Wood Johnson leadership to fulfill our mission of improving the health of this community. I am personally extremely pleased to know that each of you is here to join us in this new venture as Robert Wood Johnson Somerset. Please join me in welcoming Executive Vice President and Chief Operating Officer of Robert Wood Johnson, Vince Joseph.
Hey, you guys in the back, you want to quiet down? All these wonderful people in the front are nice and quiet. So it must be the Brunswick, New Jersey people in the back, so quiet down. Okay. Good afternoon, everyone. I'd like to thank Dr. Sugarman. I'd like to thank really the whole medical executive committee of Somerset. They have been awesome partners in guiding me through this process. I want to thank you all here. My welcoming by you has been outstanding. I appreciate that. It makes my job easier, and I thank you for all your help. I want to thank Steve Jones and the members of the Board of Trustees of Robert Wood Johnson for allowing me to partake in this great milestone event and have the opportunity to help them a little bit with it. As Dr. Sugarman said, our two campuses, our doctors have together worked together for many, many years at both campuses. That's a foundation. We're going to build over that foundation to be better and better and better. One of the things we're going to do is we're going to go out and get the best national best practice. We're going to bring national best practice here locally because we're going to continue to be the best. No question. You with me on that? Are we going to face challenges? Yes. But we are not going to hide from challenges. We're going to face them straight on, and we're going to solve them together. So here's the last thing I'm going to say. This is your homework, okay? If you haven't seen it, there's a composer, and he is a conductor. His name is Eric Whitaker. He wrote, go on YouTube and look up a thing called Sleep, Virtual Chorus. And what he did is he took 2,005 people from 58 different countries around the world and put the song Sleep together, and it's the most phenomenal thing you'll ever see on the internet. Okay? It's just awesome what he did. Now, he did that with 2,000 people. We're putting 7,000 people together, and we are going to just kick butt. We are going to be the best. Okay, enough of speeches. We're here to have a party. Let's party.